Hello, USMLE candidates. So, today we're going to talk about something that is not commonly talked about, and this is not really considered a very difficult problem when the USMLE mentors are discussing how to give your step one. They don't really consider this condition, which is extremely important, uh, not only for step one, but for other steps subsequently that you would want to give. For example, your step two CK or your step three. And you need to address this problem first before continuing. You need to address this condition. This is sort of a prerequisite, if I must say, to continue before uh, before continuing on for your step one. So this is what we're going to talk about today: how to strengthen your basics before starting your assembly step one. This problem we are going to address today. Most of the people that I come across are starting from this point. They are not starting from a point in which they can directly go into the Q bank. Although my overarching strategy is to go into the Q bank and then build your foundation from there. But although that is a very good strategy for people that want to be efficient in maximum amount of time, that strategy is for someone who wants to give his or her paper in about 6 to 8 months or a year. People that are starting early on, or students that are in their third years or second years even, and they want to understand on how to start their preparation essentially, or how to start the first part of their preparation, which in my case, I understand that there are three parts of your preparation, and the first part is to build your basics. Second part is to build your understanding, uh, the application of your basics. So the third part is your dedication phase, in which you do self-assessments to understand where you are. So at the first part, you build your basics. The second part is to apply those basics, to apply those knowledge, which comprises largely of the QBank. And the third part is to self-assess, and is to basically refine your your knowledge before the paper. So these are the three parts, and the earlier that you start uh, is the earlier that you start will give you a better advantage. So the earlier you start, the earlier you understand things, the earlier you know what your mistakes are, and the earlier you can rectify your mistakes before going on and getting into the thick of it. You can solve your mistakes and understand what they are before going too deep into study and then finding out that you don't have much time left. So there are quite a few problems that students face when starting their USMLE Step 1 prep, and this is one of the biggest problems, is what do we do about our basics before starting our prep? Someone who has weak basics, what is that person supposed to do? So I'm going to try to put some ideas into your mind regarding that with our presentation today, and hopefully you get an idea on how to start. Keep this in mind, as this is largely for people who are early on, who are basically looking for a way to start their preparation. And you must also understand that you might not be the person who needs this guide or this video. You might not be the person. You might be a person who is with average basics, basic fundamental concepts, and you're ready to move on to the application phase. You don't need to start from zero. But for someone who is starting from zero, if you've self-assessed yourself and you know that basics are a problem for you, then you need to listen to what I have to say today. So the first step is to self-assess yourself and understand at which level you are right now currently, and then move forward from there. But assuming that you are very early on in your preparation, this might be the first video that you're going to see, and you're in your second year, third year, maybe even first year, when you're looking at this and you're thinking, or maybe if you are an old graduate and you forgot your basic concepts, So if you're looking at this, then you are good to go. Okay. So first of all, we need to understand why is this important? Why do we need to strengthen our basics? First of all, you need to understand that step one basically tests you in basic concepts. Basic health sciences and basic subjects are comprise the, the meat of the step one, if you can say so. The majority part of step one, or I think uh, the 80%, it tests you basic concepts on subjects on mechanisms that are foundational. They don't really go in the deep on every subject. Sometimes they test your memory, and that memory you will have after practicing thousands of questions. That's not going to be a problem, but you need to have an understanding before even memorizing, because if you blindly memorize without the understanding factor, then it's going to be very difficult for you. So you need to understand that having a conceptual understanding is very important, not only for step one, but for step two as well, for three. Every paper, every exam builds on the knowledge of the previous one. So you need to know what the previous one is testing, and you need to understand how to perform fully. So you need to have a conceptual understanding. You need to keep that in mind. Also, having weak basics can lead to confusion regarding question solving. It can sometimes become very messy when you're looking at a Q bank and you're solving questions. If you don't have strong fundamentals, it's going to be quite messy for you to understand where the question is leading or what the question is asking. If the question is in the realm of biochemistry and hematology, it is involving both of the subjects, right? For example, if vitamin B6 deficiency causes sideroblastic anemia. So, if there's a clinical vignette about this fact, now it is involving both the biochemistry part and the hematology part, and you have to know both of them to understand the question. So, if you do not, then it can lead to confusion and wrong answers, and just what happens is that you're not even able to understand after reading the explanation itself. So that's why we have to tick this box of strengthening your basics. And of course, if your basics are strong, it's going to help you remember things. If you know the logic behind what you're remembering, it's going to help you remember the point that you are remembering. And if you feel like that you are studying something that is familiar, studying something that is uh, how you might say that you've read some read this before also. This is not something that is completely new. What that is going to do is going to give you more confidence. So if you are just going in blind and you know nothing and you are getting questions wrong one after another, you are going to be very demotivated. But if you know that you have sort of studied some part of this question that you are facing in front of you, then it's going to give you confidence as well, because then you would have the have the support of your prior knowledge. So this is basically a summary of why understanding the basics is important, and I cannot stress this enough, is that the paper comprises largely of conceptual questions that test your basic health sciences. They do not rely on rote memorization, and although even if it does comprise 20% of memorization, it is largely of your understanding. So that is the basic exam. If you're not going to follow the format of the exam, it's going to be quite difficult for you. Okay. Now, what basic usually means are these subjects, which is the physiology, the pathology, the pharmacology, and the biochemistry. These subjects comprise mostly of your basics, right? Pharmacology is not a lot in step one. I would say that they do tend to ask mechanisms and mechanism of action and side effects, but it's not a lot. But the rest are full to the brim as far as step one is concerned. And you know that you understand. the basics of anything, if you're able to explain the mechanism in your own words, if you are able to spot the systems that the question is testing, or if you're able to connect the dots. For example, vitamin B6 deficiency leads to sideroblastic anemia. So if you're able to integrate, if you know why a sideroblastic anemia would cause later on, what symptoms it would cause, what signs it would cause, how do vitamin B6 deficiency occur, if you know the complete train of thought, then you have understood the mechanism. And if obviously if you can solve questions with clinical scenarios, then you know that you understand the basic concept. So starts with explaining the mechanism and then goes on. Something that I would like to address here, which I've also addressed in the beginning of the lecture, is that my strategy comprises largely of jumping directly into the U world, right? But this video is not meant for someone who is an intermediate uh, student who has a basic understanding of concepts. This video is for someone who is just starting out. So, if you're going to ask me otherwise, I'm going to tell you to jump directly into the U world. But if you are watching this video, or if you tell me that you are a complete beginner and you have weak basics, so I will not give you this strategy. I will not give you this strategy. Likewise, I would not also give you this strategy of going in and memorizing first aid blindly. That is going to be a waste of your time. This strategy is widely used among students. Widely used. I see almost every student of third year or fourth year going for this, or anyone who's starting first aid going for this part, which is just going to waste your time. It's not going to give you the return of the investment that you're making. I would go as far as to argue that if you jump directly into the U world, it's going to be more beneficial to you rather than doing this. Okay, so I would suggest that. But you don't, ideally, you want to stay away from both of these strategies. All right, we need to find a middle ground. We need to find a middle ground. The approach that I think is going to work for you is you need to first build concepts. Now, a lot of students, especially from my university, they don't study some subjects till they are in third year. And I understand that. What you can do is in your first 2 years, you have a lot of time. You have a lot of time. You can watch videos for those in those years to build concepts of physiology, anatomy, pharmacology. Yes, you can start pharmacology in your second year, first year as well. It's not a difficult subject. It's not Difficulty is not the reason why it is taught in third year. If somebody from my university is watching, difficulty is not the reason. It's just the curriculum. That's it. Do not think that because a subject is starting from your third year, it is a difficult subject. That's not the case. Okay, so you need to watch pathology videos with physiology, watch pharmacology videos with biochemistry because biochemistry and pharmacology are quite related. So watch videos. I'm going to recommend some resources in the next few slides, but you need to watch videos. Okay. Once you understand the mechanism, then you need to go to the QBank. Once you understand the videos, for example, you have watched all videos of anemia. You go to UWorld and solve the questions on anemia. Solve 10 questions, 15 questions, how much ever questions you want to solve. You go into UWorld and solve the questions. Just to understand that where you are. After watching those videos, you will feel like you have a sea of knowledge. But in reality, how much knowledge you have, you're going to find out by going into your world and solving questions. So I would suggest to build your concepts, to understand the mechanism, and then go into your world. And after solving 10, 15 questions, getting an idea on how the questions are asked, how the case is present, read that same material from your world. And this, uh, excuse me, from first aid. Read the same material from first aid, and this is how you're going to build your concept. You watch the video, you solve some questions, and you went into first aid. If you don't even want to go into UWorld, you can go into the BNB Bank or the USMLE RxQ bank. But after solving 10, 15, 20 questions from that particular topic, or even solving the whole topic for that matter, go into first aid, and that is how you're going to understand the concept. This circle you have to keep. Okay, so uh, you don't want to just passively read the content. You don't want to do that, and you don't want to just memorize. That's not the case here. You want to use your cause and effect logic and your clinical reasoning. You need to understand why something occurs and how does that change. All right, so of course, the most important subject is going to be your physiology, because if you understand how something works, then you are obviously going to understand what happens if it won't work, which is the pathology, and then you was going to understand how to solve it, which is the pharmacology. So I believe physiology and pathology are related, and pharmacology and biochemistry are related. So if you want to study pharmacology very well, you need to study biochemistry. And if you want to study biochemistry very well, you want to study it leading to pharmacology. You want to study everything in biochemistry that leads to the pharmacology or the pathology of a case. You want to study biochemistry clinically oriented. That's what I'm trying to say. And last but not the least, of course, microbiology is also important. So, mastering physiology first. Of course, these are some of the important systems that I have mentioned. I have seen that cardiovascular and respiratory are one of the most difficult, and endocrine is one of the most asked systems in step one. Basically, underlies the baseline questions. I think if you understand endocrinology, you can understand a lot of questions. And if you don't understand endocrinology, likewise, it's going to be very difficult for you to understand most questions. Right. So, you how to study pathology and physiology again. Go for the normal physiology. For example, hypertension. You understood the normal physiology that blood vessels maintain tone while the endothelial signals nitric oxide and smooth muscle relaxation. Okay, you understood this. Now you understand the disease, the mechanism of the disease. What basically is hypertension? So normally this happens, but in hypertension, what happens is that because of due to chronic high pressure, the endothelium is damaged and smooth muscle is hypertrophied. So endothelial signals and smooth muscle relaxation were controlling the blood vessels. But now, if the endothelial is damaged, so the endothelial signals are going to be defective. And if the smooth muscle is hypertrophied, then no matter how much it relaxes, it's not going to have an effect. Okay, so you understood the mechanism, you know the normal physiology, then you understood the mechanism, and now you're going to understand what happens if the endothelium is damaged and the smooth muscle is hypertrophied. What is going to happen? So it's going to lead to progressive vessel narrowing, which is going to lead to increased afterload on the heart. And if the heart is getting more pressure, then it's going to obviously adapt to it, which is going to lead to left ventricular hypertrophy, and inevitably it's going to lead to organ damage. So this is how I want you guys to study, right? This might lead you to some back and forth, but this is the best way to study. I believe AI is your best friend. Use it. It's the best thing out there. I've given an example of pharmacology now. So let's, for example, take ACE inhibitor. Excuse me. What does ACE inhibitor do? It blocks the angiotensin converting enzyme. Fine. Now you know the mechanism. You know the mechanism behind it. What is the side effect? It leads to the accumulation of increased bradykinin, uh, because ACE, the angiotensin converting enzyme, breaks down bradykinin. So if you're going to inhibit the angiotensin converting enzyme, which is the mechanism of ACE inhibitor, that is the mechanism of ACE inhibitor. So if you're going to inhibit the ACE enzyme, what's going to happen is that bradykinin is going to get accumulated, and that's going to lead to dry cough. Okay, that's, do you understand the mechanism and you understand the side effect? Now, what is the use of this drug? The use of this drug is to decrease BP, blood pressure, and remodeling. So it treats the hypertension and also heart failure. So it's not only treating hypertension, it's also treating your heart failure, right? Because heart failure, of course, is related to your hypertension, so it's also treating your hypertension and your heart failure. A lot of hypertensive drugs don't treat your hypertension, heart failure. A lot of antihypertensives uh, don't treat your heart failure. That's what I'm trying to explain to you. Okay, that's how you study pharmacology. Now, biochemistry, how to study biochemistry. You need to focus on clinical relevance. You need to prioritize the pathways that have associated diseases. I've already harped on this point, and this is very important, or else you're going to be lost. Biochemistry is a lot, but you need to focus on what is important. Rate limiting enzymes are obviously important. You know the key regulators and glycolysis and all of that. Not really that much important. I've written it here, but it's not that much important. However, uh, it's in order of decreasing importance. I think the most important part is to figure out the clinical relevance. Then focus on the key regulators of any pathway, if there is any pathway. What are the key regulators, and then understand the vitamin deficiencies. So these three things, if you keep in mind, you know how to you'll be set in biochemistry. Okay, you need to stay away from memorizing complex chemical structures. You need to stay away from memorizing random steps, and you need to not ignore the symptoms. Biochemistry is related to pathology and pharmacology, so you need to integrate it and study it, right? That's what you need to do. Microbiology is a bit of a tricky subject. Um, it's a bit vast, and again, I think this is much like biochemistry. You need to know what you're looking at. So first, identify the pathogen that you're studying about. That's the first step. Understand the pathogen that you're studying about. Understand its virulence factor. Understand what causes the disease. What in that pathogen is the specific part which causes the disease. Okay, so Staph aureus has protein A, which causes the disease. What it does is it binds to the FC region of the IgG. Okay, obviously, if Staph aureus is dangerous, why is it dangerous? You need to know that, right? So it's dangerous because it has protein A. It also has a lot of other things, but concentrating on one thing, it has protein A. Okay, what does this protein A do? What is the mechanism? Like, what happens? When it binds to the FC region of IgG, what happens? What happens is that because IgG is an opsonizing antibody, because it binds to the FC region of the IgG, it prevents opsonization and phagocytosis. So now there is decreased clearance of Staph aureus from the diseased area. What happens is that because it's not been able to clear out, it infects the internal organs. It infects the lungs, causing pneumonia. It infects endocarditis, the internal lining of the heart, and it also causes abscesses. Excuse me for that. So that's what Steph. This is how you study microbiology. Giving you an example here of Steph aureus, but this is how you study microbiology. Okay. Uh, Something that I have given you guys here is just that you can use visual memory in microbiology. But a lot of people use Sketchy. You can use that uh, as visual mnemonics. You can see that ninja mask blocks face, so protein A blocks FC region. So that's how you can remember it. But I personally don't prefer this method, but you can go for it if you want. This is how you study microbiology. This is the part for the best resources. First aid is obviously very important, but this is not a primary learning tool. I've already mentioned it over here. So you need to have first aid. And then I think for pathology, the best is pathoma. I think if you're in second year or first year, you need to we need to pick up pathoma. All right, you need to shut down your mind, let go of any other any I might say suspicion, and go for pathoma. You know, even if you are able to study three chapters throughout your year, it's going to be it's going to be a lot of help for you. Believe me, it's going to help you understand the physiology more. And then of course you have Beyond and Beyond, and you have Sketchy. So you have these resources that you can choose from, of course. But I obviously recommend pathoma for pathology only. So how to study effectively? Again, it's easy to advise people, but you need to give away, right? And here at USMLE Forum of Pakistan, we always give you a way how to do it. So first of all, you need to avoid passive reading. Reading first aid without understanding is a waste of time. First of all, watch the concept, use the video resources, understand. Okay, revise quickly. You can use Anki for that. You can use your QBank for that. USMLE RX, BNB QBank, UWorld for that, and then go for. I think I've sort of stretched it out, but that's the idea that you understand, and then solve the QBank. Okay, and then go for first aid. So I sort of stretched it out a bit for deeper understanding. So you watch the concept, you understand, you revise quickly, or you can just skip this part and go directly and apply. Go for solving 5 to 10 questions and then understanding how much you've understood the topic itself. And again, this is how I recommend you need to start your question practice as early as possible. Questions are a learning tool, not an assessment tool at this stage. You need to focus on that. It's very important. Go for tutor mode, use tutor mode, start untimed, focus on learning, not scoring. A 40% score is fine if you learn from every mistake. Don't let low scores discourage you early on. This is a very good slide. I think this is something that most people do not focus on. Again, the simple things are what are going to make a difference on your score and on your understanding. So do not be afraid of starting questions. It's very, very, very important that you start your question practice early on. It's very important. And something that I've written here is that immediate feedback builds neural connections faster than waiting until the end of a block. So that's why I prefer tutor mode, not timed mode in which you solve all the questions first and then get the answer. That's not what I prefer. I prefer that you get the feedback right there and then so that you can understand it. You get a sort of a punch in your face when you get it wrong. That moment really builds memorization. Now, how to review your questions properly. So if you've reached the phase of questions, how to review them properly. First of all, ask why is the right answer right? Does my reasoning match the explanation? So if you have chosen a wrong answer and you don't know what the right answer is, then obviously you're not going to look at the step. But if you are unsure about an answer and you've chosen a right answer, so you need to ask, does my reasoning match the explanation? If you guessed, then treat it as wrong. Okay. Then you need to look at why the others are wrong. Read the different options. In what scenario would option B be the correct answer? You need to read that. Ignore the whole explanation and first read why the other options are wrong. First, of course, you need to understand what the right answer is, but then read why the other options are wrong and then go for the rationale, that long explanation. Okay, you need to understand, was it a knowledge deficit or a reasoning error? Do you not know the knowledge, or do you know the knowledge and you're not able to solve it, or you misread the question? It's very important. And you can make flashcards for it, but I don't recommend doing this. A lot of people prefer this, but I don't really recommend it. I've written here just for completion's sake. so that I could make it relatable for every student, but it's not really that important. Reviewing a block of 40 questions should take twice longer than solving it. So basically, what happens is that a total of 4 to 5 hours should take you on solving and reviewing a 40 questions block if you're starting out. 4 to 5 hours, just give yourself like 10 questions per hour, and you shouldn't exceed that. If you're exceeding that, then you're just wasting your time. This is a slide especially for Anki viewers. You can read this. I have not used Anki, but a friend of mine did, and she has created this slide for me. So it's basically just spaced repetition from flashcards, and you can use that if you want to. I personally have no experience for that, but I have included it just to give you an idea if you can use it. If you want a video on Anki on how to use it, I could make a video on that. Get the right people, of course, not me, but the right person to explain how to use Anki to the fullest. Integrating subjects, again, as I've told you guys, that integration is what is going to get you marks. So diabetes type 2 is a pharmacology uh, subject as well, physiology subject as well, as you can see, and a pathology subject as well. So you need to know the every part of diabetes mellitus type 2. Don't study subjects in silos. Always ask, how does the drug fix the pathology to restore the physiology? Always ask this question and you will get to the bottom of it. And once you have answered this question, then you have completely understood the topic. So I would say that always ask this question to yourself when studying every topic. Once you've gotten the answer to this question, then you have reached the understanding of that topic in itself. You need to keep that in your mind. And I've also given you a daily study structure. This is the pre-step one phase. Again, I'm emphasizing a lot that this is not your preparation time. This is just before step one. So you need to give 4 to 6 hours for this. I think this is enough for someone who's in second year or third year. You can take out 4 to 6 hours of your day for this, and you need to be consistent. And this is the pattern. So watch videos, BNB Pathoma. You don't need to take notes. If you are someone who understands by taking notes, then fine, but you don't really need to. Go for active revision, go for question practice, and this is basically a complete schedule for you. Complete schedule for you. I believe that there's nothing that is going to last. So 2 to 3 hours for concept learning, for videos, 2 to 3 hours for videos, then 1 to 2 hours for questions, or 2 to 3 hours for questions. That's enough. 4 to 6 hours. 2 to 3 hours for concept learning, 2 to 3 hours for questions, 4 to 6 hours in total. It's a very good strategy. Now, how do you know that your basics are strong? How do you know that? Once you are able to explain all of your concepts without your notes, you can teach another person, then you are ready. The number one sign, if you can teach someone else, you are ready and you have no problem in that particular aspect that you can teach. If you're getting your questions right, obviously you are ready. If you can connect topics easily, if you can read a question and you can tell someone, oh, this is taken from this topic and this topic, this comprises of this discipline and this discipline, then your basics are strong. If you can identify which topic a question is taken from, your basics are strong. And the last but not the least, you need to concentrate on understanding the part, not memorizing. Again, I have comprehensively explained this in today's lecture, comprehensively. But this is the most important part. Most important, number one part, understanding. Number two part, your Q bank, and number three is, are you able to explain? Are you able to teach someone the concept? Then you're good to go. Okay, so we'll talk about some common mistakes to avoid. You don't want to use a lot of resources. So there are a lot of resources, but I recommend choose two and stick with them. All right, you need to address difficult subjects. You need to address the boring subjects. You need to address the biochemistry. You need to address the microbiology. You need to address the pharmacology. You need to address the boring, difficult subjects. You need to do that. Most often than not, the most boring subject is the most difficult subject because that's what human psychology is. We tend to avoid difficult things, and to avoid them, we just label them as being boring or as something that is not important. But that's not the case. You need to face the demon, as they say. So use few resources, go for your weak areas with the right way. Do not do passive reading. As I've said, just reading first aid is not going to give you anything in return. And do not delay solving questions. Okay, so it's very important that you know what mistakes students make, and to avoid them, it's quite important. So these are some common ones that I've gathered from all of my time of teaching. How limited it is, but this is these are the common mistakes. And I have given you a timeline as well, right? So this again before your step one prep, so this should take you 2 to 4 months if you are consistent. So if someone is starting in, let's say, third year or second year, if he gives 2 to 4 months of his second year for this, he is going to completely conquer his basics. So physiology is going to be mastered in like 1 month. Pathology is going to take about 1 to 2 months, and pharmacology, microbiology, and genetics, biochem is going to take 2 months more. So 2 to 4 months is all that is going to take you to get familiar with all of this. To get familiar with all of this, and once you're in your third year, your fourth year, or whatever the subsequent year is in which you want to give your exam, once you're back in that zone, it's going to be a piece of cake for you. Step one is not going to be difficult for you, but you need to give this time. If you are weak in your basics, if you don't have foundational concepts, this is the time that's going to take you 2 to 3 months, right? So once you're done with the basic phase, then you transition to your dedicated prep. Then you only concentrate on high yield facts, you all concentrate on pattern recognition, you solve UWorld fast, you go for timed random blocks. Okay, random blocks is part of the part. Random is important. You don't go for subjective. Then you go for first aid rapid reviews or NBMEs. That's a different ball game. That's quite different. One thing that I've written for you to give you a sort of a guide is that you should transition when you're consistently scoring above 60% on foundation blocks. Foundation blocks are basically the basic subject blocks. So once you're scoring about 16%, then I think you're fully ready. Of course, this is an ideal situation, so it's not going to happen every time, but uh, it's still a guide. If you're able to reach this point, then you are well on your way of passing. I would go as far as to say that you are 90% passing the exam. Final takeaways. Again, we've discussed all of this quite thoroughly. Something that I want to discuss more is I'll show you guys. So you can ask us your questions again. You can study with us. But something that I want to tell you guys is that this is our page, our Instagram page, which you can follow and send us your questions over here. This is where we can address all of your questions, and you can also follow us and send us a message for a free sort of a guide on USMLE. Okay, and subscribe to our channel as well. This is our channel. All right. I hope this is a okay, and this was useful for you. If you have any other questions, you can ask us.